Welcome to ATCM, the Emergency Medicine channel. Today we will be demonstrating how to do a 6-minute walk test. This is a very simple test which can be done on an OPD basis or at home. So if you are doing a 6-minute walk test at home, you can use a small saturation probe like this, which is working with battery. Or in the hospital we use specific monitors for that. So this 6-minute walk test is used for finding the functional residual capacity of the patient, and recent times because of this COVID pandemic we will be using the 6-minute walk test to find out if the patient is having some happy hypoxia or not. So we will be checking the patient saturation before the 6-minute walk test and after the 6-minute walk test, and we will be looking whether the patient is having any sort of desaturation. Okay. So in the hospital, when we are doing the 6-minute walk test, before doing the test itself, we should ask the patient not to take a very heavy meal. You should ask the patient to take all his regular medicines and do his routine activities as a normal thing. No need to prepare himself or herself for the 6-minute walk test. And before the test, the examiner who is conducting this test should be trained at least in BLS. And while we are doing this test, arrange crash cart, oxygen, aspirin and nitroglycerin for the patient. And before doing the test, make sure that the patient's resting heart rate is less than 120, his blood pressure is normal, and patient is not having any angina before the test. Okay, so before the test, first our doctor will be taking the vitals of the patient. So she will be checking the saturation, the heart rate and the blood pressure. This will be checked before and after the test. Then we will be asking the patients the baseline Bohr dyspnea scale. So before the test itself, we will be giving the Bohr dyspnea scale chart to the patient, and patient can select the scale or the level of dyspnea the patient is having at present. Then we will be telling the patient how to do the 6-minute walk test, and then we will be proceeding to the test. So for a 6-minute walk test, we will be asking the patient to walk continuously for 6 minutes, and the patient should cover maximum distance as possible. So for doing this test, we need a level hard surface ground, and we should arrange 2 cones. We have 2 cones here, that is 30 meters apart, and every 3 meters ideally we should keep a marking in these 30 meters, and the patient should walk from one cone to the other, taking a round around the cone. And we should arrange a chair, and we should arrange some medications which the patient might require, like glycerin, nitroglycerin, aspirin or oxygen. If the patient is using some walking aid to walk, ask the patient to use that while walking. Okay. And the examiner shouldn't encourage the patient to walk more, or the examiner shouldn't talk to the patient while the patient is doing the 6-minute walk test. The patient is standing at the starting point. So at the beginning of the test, the examiner will be telling the patient to start, and then he can start walking for his 6-minute walk test. So when he reaches the second cone, he will take a round, and then he will go to the first cone. He should cover maximum ground as possible during the 6 minutes. Whenever he feels tired, he can take rest in the chair, and then he can continue walking. The examiner shouldn't talk to the patient or encourage him to walk more. At the end of 6 minutes, the examiner should tell the patient, and then he can stop walking. The patient can abruptly stop the test when he is feeling chest pain or breathlessness or severe leg cramps, or the patient is having severe sweating. Or else, if the patient is able to complete the 6-minute walk test, after the test we will be assessing the patient's vitals again and the Bohr dyspnea scale. So we will be assessing whether the Bohr dyspnea scale has worsened or not after doing the 6-minute walk test. If the patient is able to cover more than 500 meters, that means his functional residual capacity is very good, and if he is able to cover less than 200, that means he is having a very poor functional residual capacity. So I hope you have understood what is 6-minute walk test. This test can be done in hospital and also at home. If you are doing at home, you can use a small saturation probe for before and after the test. Just check your saturation, and if there is a desaturation of more than 4, that means you might be having a happy hypoxia. Thank you.